Do you get numbness in your fingers or tingling in your hands? There are a lot of different things that can cause numbness and tingling in your fingers and hands. And if you develop it suddenly without warning, it can be a little bit worrisome. Now, most of the time, the causes of numbness and tingling in your fingers and hands aren't very serious problems, but it is a sign that something is going on specifically with your nerves, that your nerves aren't healthy or are being compressed. And it is worthwhile to take the time to figure out what's wrong and what you need to do about it. Now, there are a lot of systemic causes of tingling in your fingers and in your hands, such as diabetic neuropathy, where you have high blood sugar and it affects the health of the nerves. That typically causes numbness and tingling in both your hands and your feet. They call it a stocking and glove pattern. There's also vitamin deficiencies, which can cause tingling in your fingers and in your hands. But a lot of the most common types of numbness and tingling are compressions of nerves, either in your hand or in your elbow or in your neck. And those are the types of tingling that I see in my clinical practice. Hi, I'm Dr. Dave Candy. I'm a doctor of physical therapy. And in this video, I'm going to discuss the causes of numbness and tingling that come from musculoskeletal causes. For example, from your neck, from your elbow, or from your hands. So let's jump in and get started. Now, whenever I see a patient in the office who has numbness and tingling in their fingers or in their hands, the first thing that I want to rule out is something from the neck. So we'll discuss those causes first. Now, one cause of numbness and tingling that comes from the neck is spinal stenosis. And I've made another video on spinal stenosis in your neck that'll walk through that a little bit more specifically. But there are two types of spinal stenosis. And the one that I want to discuss first is the central spinal stenosis. That's where the opening around your spinal cord becomes more narrow and it actually pinches the spinal cord itself. And that type of spinal stenosis can cause tingling and numbness in your fingers and in your hands, as well as in your feet, sort of that stocking and glove pattern distribution. You may also notice that you have balance problems or difficulty walking or neck pain or trouble looking upwards. That might make symptoms worse. And so those are some things that may indicate that you have a problem with spinal stenosis or a narrowing around your spinal cord. Now, there's also another type of spinal stenosis where the nerves in the side of your neck get pinched, where they're going down into your arm and into your hand. And that type of spinal stenosis really usually just occurs on one side. So you may notice that you have numbness and tingling in just one hand or primarily in one hand. And if that's the case, then you want to find out what level that's coming from because the different levels in your neck correspond to different areas in your hand where you may experience numbness or tingling. So if you're feeling numbness or tingling in your hand and it's coming from the C6 level in your neck, you're going to primarily feel it in your index and in your thumb. Now, if you have a C7 pinched nerve, you'll feel it primarily in these three fingers. And if you have a C8 pinched nerve, it's usually more in these little two fingers over here. Now, an area in your shoulder called the brachial plexus, that also can cause numbness and tingling in these two fingers here. And so that's something that you do want to rule out to make sure that it is coming from your neck or conversely that it's coming from your shoulder so that you're treating the right problem if you do have numbness and tingling in your hands. Now, moving down from your neck, there are other causes of numbness and tingling that come from your elbow. That this area right here on your elbow, on the inner elbow, your funny bone, that is where your ulnar nerve runs. And that ulnar nerve goes down to your ring finger and your little finger. So again, that ring finger and little finger numbness and tingling can be caused by a C8 nerve problem in your neck. It can be caused by a brachial plexus problem in your shoulder, or it can also be caused by something in your elbow, that ulnar nerve or that cubital tunnel that's right there on the inside of the elbow. So if you're having numbness and tingling in your finger and hands, I would recommend reaching out to someone, a physical therapist or a doctor who's experienced in treating those type of problems to help you figure out which one of those causes it is, because obviously the treatment is going to be a little bit different depending on what type of problem that you have. And I do have some other videos that I'll link to that'll give you some tips to use in the meantime, but I would suggest reaching out to a medical professional if you are having numbness and tingling in these two fingers, because there are a lot of things that can cause it. Now, moving down to the hand, the most common thing that people think about with numbness and tingling in the hand is the carpal tunnel. And the carpal tunnel is a little area right here. It's in the middle of the wrist, and you have a nerve that runs up through here and goes to your index, middle, and thumb. And that median nerve can be compressed when you have carpal tunnel syndrome. Now, the carpal tunnel is formed by the bones of your wrist and then a little ligament that runs over top between the bones on the thumb side and the little finger side. And when that tunnel gets too narrow or gets too compressed, it can pinch on the median nerve and give you numbness and tingling in specifically these three fingers. Now, that median nerve, it has both a sensory branch as well as a motor branch, meaning it gives you feeling, which is what will provide the numbness and tingling in those fingers. But you also may notice some weakness in your thumb and in your index finger, like you're dropping things, or if you're picking up little fine things, you may have some trouble controlling those areas. Now, usually with carpal tunnel syndrome, these areas, your little finger and your ring finger, they aren't quite as effective. So if you are having problems in these areas, it's most likely not carpal tunnel syndrome. And that is when most people think of tingling in their hands. Carpal tunnel syndrome is one of the first things that people typically jump to or think of. Now, an additional thing that I didn't mention before that can cause numbness and tingling in these two fingers is actually a compression of the ulnar nerve at the tunnel of Guyon. And that's an area right here in your hand, kind of right in this area in the meat of the little finger side of your hand. And there's a branch of that ulnar nerve that runs down into your little finger and your ring finger, and that can get compressed. For example, if you fall on an outstretched hand and have a fracture of your hand, or also if you spend a lot of time typing or resting your hands there, or if you're a biker and you rest this area on the handlebar, you can develop a compression of the ulnar nerve in your hand. So those are some of the causes of numbness and tingling in your fingers and in your hands. And just to run through the causes really quickly before we get into some solutions that you may be able to do to help relieve those problems, can come from your neck. And that could be either a problem around your spinal cord or spinal stenosis. It can come from the peripheral nerve roots that come out of your neck and go down into your arm. And depending on the level the nerve root is compressed at, it can affect where you'll feel that tingling or which fingers you'll feel that tingling in. Then moving down from there, your brachial plexus in your shoulder can cause numbness and tingling in your fingers and hands. Moving down from there, the cubital tunnel in your elbow can cause numbness and tingling in the little finger and the ring finger. And then moving down from there into your hand, you've got the median nerve, which is usually these three fingers. And then again, the ulnar nerve or the tunnel of Guyon, which is these two fingers. So those are the causes of numbness and tingling in your fingers and hands. So what do you do about it? Well, again, the solutions are going to be affected by the cause of the problem. Again, I'll link out to other videos with more details, but just to give you some general ideas, if you're having a pinched nerve on this side of the neck, usually looking upwards and bringing your head to that side will further pinch that nerve. So doing things like either bringing your chin down towards your chest or moving your head away from the symptomatic side will help open up the areas there. Now, if you do have more of a central problem, for example, around the spinal cord, moving to either side really probably isn't going to affect it. Looking downwards can kind of functionally make the spinal canal larger, even though it doesn't widen the diameter around the spinal cord. It can help to relieve some symptoms if you do have a compression around your spinal cord. Now, moving down from there, if you have a problem in your shoulder, a lot of times stiffness in your chest muscles or stiffness in these muscles in the neck can compress the brachial plexus or the nerve bundle that runs through your shoulder. And so, depending on the issue, you may want to stretch these muscles if they're too stiff. But some people have a lower shoulder where one shoulder is lower than the other ones. And in that case, stretching it actually can make the problem worse. It puts more tension on that bundle. So if you happen to notice that the shoulder on the side that's affected is down lower, then you probably don't want to stretch your neck muscles. There are some other things that you can do, for example, reaching your arms up in the air to help raise that shoulder. But again, specifically if you're dealing with this problem, it's probably worthwhile to reach out to a professional to get individual advice, because as you can already see in this video, there are a lot of different things that can cause numbness and tingling in your fingers and in your hands. Now, the area in your elbow, the cubital tunnel right there, that gets compressed the most when you have your elbow maximally flexed or bent like this. So avoiding positions where you're at end range elbow bending can be helpful to relieve symptoms from a cubital tunnel syndrome problem. And I will link a little bit more specifically to that one in a different video. Moving down, you've got the carpal tunnel in your hands. One of the best treatments for carpal tunnel syndrome is wearing wrist braces at night, because when you're sleeping at nighttime, you can't control the position that your hands are in. You may end up with your hands in like that, and you can't control that. So putting some wrist braces around your wrists when you're sleeping at night can be a way to help out if you do have carpal tunnel syndrome. Now, additionally, if you're using a keyboard, office workers can develop carpal tunnel syndrome a lot. So if you're using a keyboard, you want to avoid resting this part on the keyboard or on a wrist rest. You really actually want to kind of float your fingers over top of the keyboard. It is important to sit with good posture in your chair, partially because it helps with the neck and shoulder issues that may be contributing to the numbness and tingling in your hands. But when you rest your elbows on armrests, it also takes some pressure off of your wrists. You don't have to rest as much pressure on your wrist, and you're less likely to compress your carpal tunnel. Now, doing stretches for your wrists, like pulling your wrist backwards or bringing your wrist forward, are some common things that people do for carpal tunnel syndrome. I would say for most people, bringing your wrist down this way is not a good idea, because that further compresses that carpal tunnel down there. But bringing your wrist back the other direction, back that way, and stretching may be a better solution. And I'll link to another video with more stretches and exercises that you can do for carpal tunnel syndrome. Now, finally, that last thing that I mentioned, the tunnel of Guyon, where your ulnar nerve runs through this area right here, it's a fixed area that runs between bones. And so really there's not a lot of stretches or exercises that you can do for that area. The main treatment is just avoiding putting pressure on that. So not leaning on the handlebars of a bike, not leaning on that hand excessively when you're typing, or not resting that area too much on the edge of the desk or on the keyboard. Those are the main treatments for a tunnel of Guyon problem. So those were the various causes of numbness and tingling in your fingers and hands. And like I mentioned, it is a good idea to reach out to a healthcare professional if you do have that, because you want to get the right treatment for the right problem. And that'll help you solve it quicker than if you're trying to do it yourself and kind of guess based on YouTube videos. So if you are in the St. Louis area and you need help for numbness and tingling in your fingers and hands to help figure out what's wrong and what you need to do for it, then contact us at More for Life. And if you're watching this from somewhere else, but you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and have a great day.